Hello everyone, my name is Dr. Mallikarjun Kalashetty. I'm the head of the Department of Clinical Haematology, Haemato-Oncology, Bone Marrow Transplantation and Cellular Therapy at Manipal Hospital, Old Airport Road, Bangalore. Today, I want to introduce the topic of bone marrow transplantation. I'm sure all of you heard about bone marrow transplantation. Bone marrow transplantation is an intense medical procedure offered to patients who may have a cancerous condition, who may have a bone marrow failure syndrome, or who may have other inherited conditions like thalassaemia, sickle cell disease, or rare inherited primary immunodeficiency disorders or storage disease. Bone marrow transplantation is divided into two types: autologous bone marrow transplantation and allogenic bone marrow transplantation. Autologous transplantation, as it is self-explanatory, is a procedure where we collect the stem cells from patients themselves. Autologous transplantation is commonly offered to patients who have conditions like multiple myeloma, relapsed refractory lymphoma. In these conditions, initially the patients are treated to reduce the burden of the disease, and then we collect the stem cells from the patient and admit them and give them high dose chemotherapy to reduce the disease burden as much as possible. The other type of transplantation is called as allogenic bone marrow transplantation. This is done by collecting the stem cells from healthy voluntary donors. If the stem cells are collected from patient's own brother or sister who have HLA matching, which is tissue typing which is matching with the patient, they are termed as matched sibling donor allogenic bone marrow transplantation. There are many patients who may not have a HLA matched sibling. In such individuals, either we collect cells from donor registries called as matched unrelated donor transplant, or we use the stem cells from the siblings whose tissue typing or HLA is not matching with the patient, called as haploidentical bone marrow transplantation. The common clinical conditions where we consider allogenic bone marrow transplantation are conditions like acute myeloid leukemia, acute lymphoblastic leukemia, aplastic anemia, thalassaemia, sickle cell disease, and host of other inherited conditions of marrow failure or immunodeficiency. We here at Manipal Hospital, Old Airport Road, Bangalore, have been running the bone marrow transplantation program for a very long time. Ours is one of the initial transplant centers in the state of Karnataka. We offer transplants to all individuals across the board, both young and old, and patients who have either benign, malignant, or rare inherited disorders. Thank you.